Hello, I'm Dr. Rudy Kasha. I have offices here in Sacramento and Granite Bay, and if you're watching this video, then you're either considering or set up to see me for a consultation for tummy tuck. So in this video, I'm going to talk about that, give you some information that hopefully will help as you kind of navigate through this process. So tummy tuck or an abdominoplasty is an awesome surgery. It's one of my favorite things to do because it's a big bang for your buck surgery. So it really makes a difference. Obviously, for the most part, these are women that have had kids. So obviously the changes that happen to your abdominal wall, the skin, the tissue that's from that, or patients, both male and female, that have lost weight and have excess skin that doesn't snap back. So that's kind of the typical patient population for something like this. But it makes a super nice difference. It is one of the bigger procedures that we do. So there's a little recovery involved with this, and we'll talk about that, but it's very, very tolerable. So key things with the tummy tuck. Basically what it's addressing is skin excess, sometimes some fatty tissue as well, some fullness. That's basically the liposuction part addresses, and then muscle wall laxity. So with a typical tummy tuck, there's a decent size incision, so it's very, very low though, so even below kind of where a C-section scar is. So down below your underwear line, your bathing suit line, but it can come out a decent length. That may be shorter, or in some patients that may go all the way around. So it varies with that, and that can be kind of tailored into other procedures like a lower body lift and things like that. But based off of where that skin excess is, that's what determines the length of that scar, but it's hidden very well. Then we lift that skin flap up all the way to the bottom of your sternum. So it's kind of lifting a drape of tissue. You can see this on my Instagram and things. There's a bunch of, they're kind of gross videos, but if you're into that, you can watch that and it'll really make it make sense. But we lift that skin flap up so that now we're looking at your abdominal wall. We leave the belly, but this is kind of a common part that people are confused about. The belly button itself, or the umbilicus, stays where it is, the stalk, so to speak, stays where it is, and we release the skin around it, lift everything up. Now we're looking at the muscle. That's the part typically for a lot of women after kids that's been stretched out. Sometimes it's a true diastasis rectus, which is where that central portion is spread apart. Other times it's just laxity in the abdominal wall. So we do what's called a rectus plication with permanent suture that's going to bring all that together. Think of it kind of like an internal corset that flattens your stomach and narrows your waistline. So it really helps to shape everything a whole lot better and makes a nice difference. Then once we've done that, then we're going to redrape that skin back down, take off all the excess basically, and then bring the umbilicus or the belly button through the new portion of skin that used to be actually higher. So all that gets taken off, everything gets tightened up with the skin. And then I like to do 360 degrees liposuction all the way around. Some people don't need it, so if you don't need it, we don't do it. It saves you some money. But basically we'll turn you over, liposuction everything, and that helps everything to just kind of sculpt into basically the shape or the contour that we want. We want the curves all in the right spot. So that's what really helps with that, to make everything look really, really natural and not like we just did some kind of surgery to achieve this, but it's basically just you. So that's what restores the shape back to your body, especially after those beautiful kids have taken a toll on it. So that's the tummy tuck itself. For the surgery, it typically takes about, ranges for different people, but anywhere from about 2.5 hours to 4 hours. It can kind of range in that range. That's done in our surgery center, Sacramento and Granite Bay. We have a full team, nurses, scrub techs that work with me all the time. You'd have general anesthesia with a board-certified anesthesiologist. Spend some time in the recovery room afterwards. Once you're ready to go, you go home. You go home that night and then you come back and see me usually the next day, sometimes 2 days afterwards. You just leave everything in place during that time and then we check on everything, take it all off and show you when you come back and see me. Some key things to know, that first night you're going to ooze and drain a bunch of fluid. That's normal. Basically, it's the fluid I inject into you for the liposuction, so that's one thing to know that first night. And then also one of the risks that goes along with this are risks of blood clots. So that can be a DVT or a pulmonary embolism. Those can be life-threatening. It can happen with any surgery, but more so related to longer surgeries. You may be aware of this from, say, if you had a C-section, they would have talked to you about this. But it's very important that you walk, and we'll give you kind of a walking schedule. You'll do that night when you get home and then starting the next day. We also send you home with these pumps. They're called SCDs that you'll put on your legs, and that pumps so that it keeps the blood circulating and decreases that risk. And then we also use what's called Exparel. which is a numbing medicine that we inject into your ab muscles that lasts for 3 days. So obviously it helps you feel a ton better. You're in less pain, you're using less narcotics, which decreases your constipation risk as well, which is a good thing. And it helps you move around better, so it decreases your blood clot risk as well. In certain patients, according to a scale called a Caprini scale, if they are at higher risk, we actually will put you on blood thinner for that, but that varies according to the patient. There's also other risks that go along with any surgery, bleeding, infection, that sort of thing. There can be risk of issues with the belly button itself because we're devascularizing it or decreasing a lot of the blood supply to that by having to cut around it. There's some risk of healing problems with the skin flap because we're cutting a lot of blood supply to that. Usually it does just fine, but that's also a risk. Anytime we do liposuction, there's risk of contour irregularities. Usually goes just fine, but that's something also to be aware of. We also don't want to liposuction in areas too aggressively where we're not taking skin off because you can get laxity of skin, so that's something we're cautious of as well. There's anesthesia risks, but typically these patients are healthy. We screen for all of that as well, and so that risk is very, very low from that standpoint. After surgery, you'll have multiple visits with me to see me, so we check in on things as we're going along the process. For most people, just to kind of give you an idea, you'd take 2 to 3 weeks off of work. Everybody, your motivation plays into it a lot, I'll be honest, on this surgery. If you kind of push yourself a little bit, not too much, but enough, you'll proceed along the recovery process a little bit faster. And most people do better with that. So 2 to 3 weeks for work, 6 weeks of restrictions, so no core activity, no cleaning the house, no vacuuming, no exercising, anything like that that could tear that repair that we did or cause bleeding. So we want to be very careful with that. But overall, tolerated very well. You'll wear garments and things that we give you, so you don't need to worry about that. But that's for about a 6-week period, and then we'll release you from that as we go along. But awesome surgery, makes a super nice difference, and really restores some of the things that your beautiful children may have taken from your figure from before. So it's a great surgery that many women are very, very happy with, and men too, under certain circumstances, usually from the weight loss standpoint. But hopefully that helps, gives you some information to help along your journey. I look forward to seeing you at the consult, and we'll talk a little more specifically